Hello, everyone. My name is James Pope, and I'm going to give my presentation on pervasive health monitoring and overview, and this is for the Health Data Research Network. So I'm a lecturer in engineering mathematics. I started my research with IoT and wearable data, and I was actually collecting it for healthcare for the Urval project that I will talk about. And then as we collected the data, it was subsequently analyzed using machine learning and artificial intelligence techniques. And so I do a lot of that these days using machine learning for pervasive health and also for cybersecurity applications. So pervasive health monitoring has been around a while, and the idea is that you would be monitoring participants in an unobtrusive way to monitor their health status. And this could be used with smart homes, perhaps wearables, ambient technologies, and it should fit into their everyday life. And so certainly things you've heard that would fit into pervasive health monitoring would be also human activity recognition, indoor localization. And one key aspect I want to point out is that really with pervasive health monitoring, it should fade into the background and individuals really forget that it's there so that they don't change their behavior. Some characteristics are that it's continuous, unobtrusive, context aware, that in some sense knowing your location or your activity, these things are important. And also remote accessibility. Generally, the data would be stored, for example, in the cloud. Key technologies, of course, the cloud would be involved, as I mentioned, but also wearables, ambient sensors, mobile health, of course, with phones. And then as we're collecting all this data, it's being analyzed using AI and machine learning techniques. Some of the benefits are early diagnosis, personalized healthcare, and preventive, reducing hospital visits, etc. But also, this information can be shared with the hospital to make to improve the quality of care as well. There's still challenges here, particularly around AI and healthcare monitoring. Many AI methods work very well when you have a lot of supervised or annotated data. And generally, with pervasive health monitoring, we don't have a lot of annotated data. The other issue that is still unaddressed really is who owns the data, who stores and controls the data. And so these are still questions to be addressed. The use cases, I will talk about a couple of smart home ones, then also a mobile one, and a couple of others. Two that I don't have any slides on that I will talk about are the rest, where we're using wearables to monitor sleep and activity to predict mood. This is being led by Hannah, and also we're looking at potentially using pervasive health monitoring in health camps in Nepal with Myanmar Sherpa. So for smart homes, I started doing this research about 10 years ago. This is a bit old, and the idea was there's a patient that's going in for heart valve surgery, and the doctor's currently on the y-axis. We have some measure of activity, and the person has low activity or low energy before the surgery. Afterwards, we think they would have lower energy. Nobody's better after the surgery, and then in the late recovery period, their energy or activity would be higher than it was when they started. And so this would be the hypothesis for a successful intervention. And what we wanted to do was a patient deployed smart home that would give us a continuous measure of this activity. So we developed this kit, and this was a wearable we developed at Bristol. Of course, now you might just go purchase. There are many research grade wearables now that will give you raw data, but we developed this one at Bristol, and we deployed it with this kit that had all these anchor points, and the wearable would give you activity information from the accelerometer on it, and then the anchor points would give you location information, so you would have an idea of indoor localization. And then from this, you can derive quite a lot of information. This was from an actual patient, and this was a successful intervention. We looked at the average room transfers, and we can see that they're better in the late recovery period than when they started. Of course, they weren't in the right afterwards. They were not as moving between rooms as much. And then also average daily hours outdoor was quite increased and a little bit better for the walking. But we were also able, for example, to assess sleep quality. So this research has moved along. We then used a similar setup to monitor people with Parkinson's disease. And so this is with the accelerometer. With Parkinson's disease, people get tremors in their extremities. For example, in the hands, that might be picked up with a wrist-worn wearable. Detecting the tremor is actually relatively easy. So this is an example of just using a threshold. The real research question was not, was there a tremor? The question was, is how severe was the tremor? So we then use machine learning techniques to do that as well. So this research had moved along as well. So to include cameras. So PD sensors not only had the wearable, but they also had cameras. And so the question now is, can we from the camera data? So this is using pose points. The idea is that this provides a little more privacy. We want to just use the pose points to determine the human activity for the patient. And the activities that we're interested in are actually these activities because these are important for clinicians and understanding Parkinson's disease progression. For example, the turning duration. The next leap would be, so to speak, would be to look at the camera and the wearable data and combine it with a multimodal human activity recognition. And that's what we're currently doing on the TORUS project. Again, looking to see if we can get a better activity recognition for those patients. And at this point, I'm going to turn it over to Thrisha. Thrisha is one of our MSc students in the data science program working on this project. Thrisha.
Hi everyone, thank you James for introducing me. I'm Trisha. I'll be talking about the app development and machine learning approach for our NIHR funded initiative project, which is co-design of AI algorithm for personalized exercise videos to enhance community-based stroke rehabilitation. We are building a cross-platform app using Flutter that runs on Android, iOS, and web. It's co-designed with clinicians, people with stroke and digital health experts, and HCI team and AI team to make sure it's clinically relevant and accessible. Each patient receives a rehab routine tailored to their condition, goals, and recovery stage. The app tracks detailed session data like exercise type, level, duration, pain, difficulty, and feedback alongside demographics and their clinical history, and therapist reasoning like range of movement and target goals. On to the next slide. This rich data forms the foundation of a machine learning model. We are aiming to use natural language processing to interpret feedback and random forest or decision tree to generate personalized recommendations. The goal is for the model to imitate the clinical decision making, adapting exercise levels like easy, moderate, or challenging based on the patient's progress and trends over time. Ultimately, we want to support the clinicians, not replace them with an ethical, intelligent system that makes stroke rehab more adaptive and effective. Thank you so much, and over to you, James.
Thank you, Thrisha. So another project that I've worked on is a more in the mobile health area with an app, a phone app. So we did not develop a phone app, by the way, but they are coming out now. And the idea is that the phone app would take a picture of a mole, and from the mole, it would tell you the type of mole that it is or skin lesion. And one thing that would be quite important to know, for example, would be if it's cancerous or not. And so these apps are now coming out, and what we were interested in was determining if the apps had tone bias. For if what we mean by that is, does it perform better for lighter skin or darker skin images? And so we wanted to be able to answer this question. And so one thing we worked on this with Hugh Day and Will Chapman from the Gene Golding Institute. One thing that's quite a challenge was actually to define light skin and dark skin from the Fitzpatrick skin type, and that's in some sense ongoing research. But we use Isambard AI to train this model, do the hyperparameter searching for it. And we did find that it, in fact, did have a tone bias. So what we saw was we used a disparate impact, and a model that doesn't have any bias for a variable, for example, skin tone, which should be around 1, so or between 1.2 and 0.8. So this is a control variable, and what this means is that this model is not biased regarding this variable. So this red line here is actually the skin tone. Basically, the model does perform better for for lighter skin tones than for darker skin tones. And it does end up showing that the model is biased using the 0.8 threshold, which is a common threshold used. We also found that whether that we balanced the data set between light and dark images, and the bias was still there. So the final project I'm going to talk about is in the very early stages. I'm working with University Hospitals, Bristol and Weston, and we're looking at surgery. So for people that go in for general surgery, which is called perioperative, or the operation, during the operation, we want to know if they will die during the operation or within 30 days afterwards. And so there are quite a lot of information they currently use about vital information about the before the operation and after the operation, pre-op and post-op, also during the operation vitals, as well as blood and gas measures that they get. And so would they then use this currently to basically stick this into a model and then try to predict are they going to die during the operation or within 30 days? And of course, with pervasive health monitoring, we could then look at a lot of information before they even get to the hospital that may be able to help improve this prediction. So some things, risks to be aware of for AI in general, but of course AI in health. And these are risks that were identified by Jeff Hinton. He's known as the godfather of AI. So these are risks that he's identified, and some of these are certainly important, such as deepfakes, massive job losses, discrimination and bias. End of humanity is quite a large one. But I do like this quote. Do not forget that AI will be immensely helpful in areas like healthcare. And he's giving this as an area why AI should not be banned or heavily regulated. You may or may not agree with that, but I do think the takeaway from this is that AI has huge potential benefits for health and healthcare in the future. Thank you for listening.
Thank you.